St Augustine's and Kingsway hospitals in KZN will be reopened today. The private facilities were closed last month after patients and staff tested positive for COVID-19. Unions accuse the company of not providing healthcare workers with adequate personal protective equipment. ENCA's Tuba Villani is following that story and joins us now. Tuba, so are they ready?
Yes, thank you so much, Jane. We still here outside the St. Augustine Hospital. Maybe just before I speak to Manda Shabang, who's the Provincial Secretary of DINOSA, let me just mention that I've just managed to walk past the trauma department of the hospital, and I saw that workers are indeed walking in, and there is a marquee that they've erected just before the hospital, the main entrance. And that's when workers, they got screened. That's where their temperatures get checked, and then they also get sanitized before moving inside the facility. But we understand that they have been given a green light by the Department of Health in the province to open today. We're not sure yet whether there are any patients that have been started arriving at the hospital. We're still yet to get that. But let me now bring in Manda Shabang, who is the Provincial Secretary for DINOSA. Baba, thank you so much for your time. Were there consultations with unions in regards to this opening today?
Good morning, Tuba, and the viewers at home. We can confirm that there have been continuous engagement between Netcare at a national level with the stakeholders, which are unions. The last meeting that took place on Friday, when this question was asked regarding the opening of the hospital, the National Department of National Healthcare made it clear that it is not in their interest to continue closing the hospital, but they are waiting for the Department of Health and the Department of Labor in the province, who is the one who closed the hospital. Now, we checked with the Department of Health on the progress, because remember, there was an investigation report that one was expecting that would guide us to say what went wrong in this hospital. So that investigation report was not favored with us on Friday, and the Department of Health confirmed that they have not given a direction to open the hospital. We're very surprised when we saw on the news on Saturday that there is a media statement issued by Netcare Group, which was saying they are opening today. We then followed up with the Department of Health, which did not confirm anything until yesterday, where the media was briefed by the Premier and the MEC, who indeed confirmed that the hospital is opening today. But in our view, the main reason was to establish, through investigation report, what went wrong, why so many workers were infected in this hospital. We thought that report was going to give us the findings and the recommendations thereof to say, what is it that can be done to mitigate the infections in this hospital? Unfortunately, as of today, we don't have such a report, we don't have such recommendation, which will make it very difficult for us to even assess whether the hospital has complied with the recommendations or not, because the hospital is opening today. We don't know what they were mandated to do by the Department of Health so that they could open. We do not know what were the findings or recommendations of the report. Hence, we are saying our members are in the dark when it comes to this issue, because what has been happening is that they are not informed on the matter. Thank you.
Nopala, very briefly, what is the feeling, the mood? You have your members here. What are they saying?
The issue of our members in the hospital, that indeed they are very frustrated, Tuba, because they don't know what has been done since they left the hospital, and now they are called back to the hospital. They have not been taken through on what measures have been put in place so that they are make sure that they are safe in the environment, and that when they continue working, what should be the way forward when it comes to PPE, because they were complaining about them not being issued PPE. So their plea is that at least if they can be secured by giving PPE so that they are safe in the plane when they're moving forward. But it is very difficult to deal with the situation when you do not know where the infection came from and how do you mitigate those infections, so that our members can also cooperate in ensuring that there are no more infections in this regard.
Any action from your side moving forward?
Our action is that we are still waiting for the report from the Department of Health, and we want to take that report and go through it and see where our members are taken through, so that the investigation report will guide all of us to say, how do we avoid such infections instead of just working as normal? And our members are urged that they must maintain those infection control measures if they feel that the management is not providing them the PPEs. Our members must not expose themselves to this danger. They must refuse to work without any protection.
Thank you so much. That was the Provincial Secretary of DINOSA, Manda Shabangu, is saying that so far, according to their understanding, was that they were not in fact told that the hospital was opening today. Is saying that they're still going to engage the two parties that are involved, that is the Department of Health in the province as well as NEDCA. Is also saying that they were expecting the release of the investigation that was instituted by the institution. We understand there was also another investigation that was instituted by the Department of Health in the province. So far, we're hoping that NEDCA will be able to speak to us. We've spoken to the PR company that manages their media issues. They've indicated that they will get back to us in due course. So we still hope that they will get to us and they will avail themselves so that they will bring the public and their clients into confidence as they are opening today. Is the institution and or the facility safe for public use?